Merci encore une fois à tous d'être là. Pour ceux qui nous rejoignent aujourd'hui, je suis Géraldine Lissal de Bonnet et je suis en charge des activités liées à la santé pour GS1. Et dans quelques minutes, je serai rejointe par les panélistes pour commencer cette troisième après-midi aux matinées de discussion sur les soins de santé en Afrique francophone. Avant toute chose, je tiens à préciser que les diapos qui ont été présentés sur les deux premières journées et qui le seront aussi aujourd'hui seront disponibles sur le site internet de l'événement. Et vous verrez dans le chat le lien vers ce site internet qui va apparaître dans quelques minutes. Donc nous avons, merci beaucoup, c'est la magie d'Internet. Nous avons passé toute notre journée hier à voyager d'un pays à l'autre à travers l'Afrique pour voir un petit peu quels étaient les développements, quels étaient les progrès faits par ce pays en matière de traçabilité. Et c'était très intéressant. Donc, encore un grand merci pour tout ça. Aujourd'hui, ce que je vous propose, c'est d'explorer un petit peu quels sont les outils et quelles sont les initiatives qui ont aussi été développées par les organisations partenaires au développement pour l'Afrique afin de contribuer à cet effort général de traçabilité pour la sécurité des patients. Et pour ce faire, comme je le mentionnais il y a quelques minutes, je ne vais pas prendre la parole toute seule pendant 80 minutes, mais je vais être rejointe par des panélistes. Donc, j'ai le grand plaisir d'accueillir avec moi Parambir Gill, qui représente le Global Fund. Donc, je ne vais pas lire toutes les biographies parce que, comme vous voyez, elles sont en anglais et j'ai décidé de parler français, mais vous aurez les diapos et vous verrez chacun des panélistes défiler. So Parambir is a specialist on supply chain digitalization, planning and innovation at the Global Fund. Together with Parambir, we will have Carl, and Carl is coming from the WHO. And at the WHO, he is in charge of everything related to supply chain. And I think we have a slide presenting Carl as well, if you don't mind to move the slides, but I will keep on talking. Then we also have representing UNICEF, and in particular the supply chain division of UNICEF, Gwen Courtney and Max Cabalissa. And both of them are going to talk to you about a very special initiative called TRUST, enabling traceability and verification of medicines. And last but not least, we will have also Linda Best-Dobie, who you all know. And Linda Best is coming with us to represent USAID with Joe Shobi. And they are both going to also present for one of the first time a new initiative called TIUP, which is enabling you to have real-time visibility on your medicines along the supply chain. Après ces quelques mots d'introduction en anglais, je repasse au français pour proposer à chaque panéliste de nous présenter en quelques minutes les initiatives proposées par leur organisation. Et ensuite, nous participerons ensemble à quelques questions que j'ai préparées. Et ce sera votre tour de poser vos questions. La première personne à qui je passe le micro sera Parambir pour quelques mots d'introduction sur l'initiative lancée par le Global Fund. Parambir, the floor is yours.
Thank you, Geraldine. And bonjour et bienvenue. Je suis désolé, je ne parle pas français, je parle pas anglais. Next slide, please. So I'll just, and Geraldine, thank you for the introduction. I will just speak to, the Global Fund and its vision towards, traceability and so on and so forth. As many of you know, Global Fund is the largest procurer of health products in the fight against AIDS, TB, and malaria. And to have effective programs, one of the most important things is to have the right product in the right place at the right time in the right quantity. That means that the supply chains in country must be extremely efficient, and folks in country must be able to know what products are where, and that means they should have visibility into the location of products within their supply chains. Also, we want to make sure that supply chains are secure, there are no leakages or diversions, or the opportunity for falsified medicines or falsified health products to enter into the supply chain. We want to make sure that the end users are confident of the health products that they are getting. So how does one get all of this within the country? One of the tools that is available is GS1 standards. When when we can when we can individually and uniquely identify health products, information systems can be leveraged to provide visibility and tracking of the health product as it moves down the supply chain towards the end user. Also, the same information can be used to verify that the health product is a genuine product and not a falsified product. Any leakages or diversions from within the public health supply chain in country can also be detected and remedial action can be taken. Now, how does Global Fund actually provide this support to such an important aspect of the supply chain and health products? So Global Fund actually officially supports the adoption and implementation of GS1 standards for health product identification. And there are two different documents. One of those is the Guide to Global Fund Policies on Procurement and Supply Management of Health Products. And it specifies that the Global Fund itself internally will continue to mandate the use of GS1, the adoption of GS1 standards for all its suppliers as the framework purchase agreements are renewed. And already we have seen a result of this, that basically all the ITN manufacturers that are supplying ITNs to Global Fund are fully compliant as of last year. The majority of the high volume suppliers for tuberculosis and malaria are also compliant. And as their framework purchase agreements get renewed, they will also start complying with the use of GS1 standards on their health products. Additionally, the principal recipients are being mandated to include formal requirements when they do procurements to make sure that the supplier starts using GS1 standards for health product identification. And I'll be repeating this part, that this is one document that says that Global Funds will support the country's uptake of global GS1 standards. We also published a supply chain technical brief that recommended, and this was basically for the principal recipients for NFM4, but it is useful for the path ahead also. So again, it also specifies that GS1 standards are supported by the Global Fund for health product identification. And we also support the updating of in-country supply chain information systems so that they can use GS1 standards for master data definition. And as those supply chain information systems are updated, they can be used for tracking products as they move through the supply chain to the end user. They can be used, that data can also be used for end user verification of the health product to make sure that it is a genuine product. Next slide, please. Global Fund it also works with the larger community to make sure that there is proper guidance, and that guidance comes in the form of different documentation that is available. So Global Fund has worked with the TraceNet working group to specify how GS1 standards could be used for improving for adopting and improving the use of GS1 identifiers on insecticide treated nets. Global Fund has also contributed to and it's supporting the the updated target software standards. And those provide the detailed specification of in-country supply chain information systems. And we have mandated over there that GS1 standards, amongst others, should be used by countries and within information systems for unique health product identification, for master data, and so on and so forth. If you could please move to the next slide. Thank you. Now, Global Fund not only provides guidance, but also provides support to various initiatives. And one of those is that Global Fund has funded, along with the Gates Foundation, the development of a comprehensive ITN campaign management tool. And this tool is being developed by an entity called eGov. And that's where Global Fund has insisted on the ability to use GS1 standards, the reading and deciphering of GS1 data. This solution has already been used in Mozambique and Liberia. So reading both the data from the bale and from the individual nets is functionality that is being built into the tool. The functionality that we're looking forward into the future is to be able to get data from the manufacturer into the tool, either directly or indirectly. So not only can tracking be done, but also verification can be done at the same time during point of dispense. And though we will hear about the trust solution, which is for that is a traceability and verification solution, Global Fund has supported pilots in both Rwanda and Nigeria. And Global Fund on its own is working with its own suppliers so that they can enable sharing of data from the suppliers into trust and then possibly into solutions like the one that eGov has produced for IT and campaign management. And it is for use in country, either for in-country verification solutions or in-country with the drug regulatory authorities or with the in-country supply chain information systems. Global Fund provides this support through, and all the principal recipients, if there are, please do reach out to your country teams. They'll be happy to provide and facilitate such processes. Just want to thank everybody for their time. Thank you so much. Geraldine, back to you.
Thank you, Parambir. Stay online because I'm coming back to you also in a few minutes. But now it's my pleasure to welcome Carl, kind of on stage, and to give you the floor for the next introduction to the WHO initiative. Thank you, Carl.
Thank you. And apologies that Rami is not able to join us today. He was out due to illness, but this is intended to be a joint presentation. Hopefully I can cover for him appropriately. So next slide. I just wanted to talk through some of the initiatives that WHO is initiating through related to supply chain. The first is a product catalog management tool, which we are hosting as part of our internal WHO infrastructure. This product catalog management tool is compatible with standards such as GS1 and HL7 Fire. And the intent is that we will host multiple catalogs for that are in use by WHO for the SMART guidelines work, as well as for other types of catalogs that come in. As we have multiple catalogs and uses at WHO, we know that other countries and organizations may also be interested in hosting their own catalogs. And so if you're interested in having a product catalog management tool, but don't necessarily have the infrastructure or wherewithal to deploy your own, please reach out to us. And we'd be happy to get connected and see what we can do to help support you in making use of a product catalog. The intent is that all catalogs will be shared and open as a global good, and will map to all the relevant international standards, with the intent of integrating product catalogs and supply chain tools within the larger health system architecture. Next slide. The next initiative is a development of a set of handbooks related to digital transformation, particularly for you all in the supply chain area. We have one that is drafted, going through final review and publication process around architectural approaches for digital health supply chain, including sort of step-by-step guidance on how you can approach investments in digital health architecture, how to think about the systems, some of the risks involved. All of this follows some of the best practices in digital investments that WHO has provided recommendations for through the Digital Implementation Investment Guide. It tells you, explains how to leverage existing artifacts such as the supply chain maturity model, the product catalog management tool, the target software standards for supply chain systems, where to link with HL7 Fire as a health supply chain, a health information system standards, and how to align any investments that you're making in digital supply chain with health information systems. This was developed through engaging WHO regional offices, as well as the larger community for the inputs into the content on the handbooks. The first handbook, as I mentioned, is coming out now around digital health supply chain architecture, and we have forthcoming handbooks related to product catalog and traceability. Next slide. As I mentioned, this was developed in an open format through the Digital Health and Interoperability Working Group. We had 50 participants, over 10 countries, and 20 organizations, including Ministry of Health. We feel this represents a lot of the best practices that we collectively have determined for supply chain investments. It does include case studies from Rwanda, Malawi, and Nepal, and feedback was sought through public consultation. Next slide. Here you can see a little bit of some of the tools and artifacts that are in the Digital Transformation Handbook. It's a little blurry, sorry about that, but you can see on the left-hand side a tool that you can use to chart out what your current state of supply chain solutions are, the types of solutions they are, where they fit in, and how they relate to each other, which are shared services, which have sort of specialty needs, how they link to other systems. And you can use these worksheets and templates to map both your current state and future state, so you can start making educated and evidence-based decisions on the types of investments that you're making in digital supply chain. Next slide. The second handbook is on the product catalog. It will inform both how the WHO product catalog management tool is being used and some of the assumptions around the data models for supply chain in there. But it would also provide guidance for you all that as you consider the deployment of a product catalog. Has a number of sections that you can see on the left-hand side that really go through the process of establishing the policy framework, how to institutionalize the use of a product catalog within the Ministry of Health, and how to develop, go through the change management and governance that's needed for that. Next slide. Turn it over to.
Thank you very much, Carl. So next slide is the perfect transition to the UNICEF team who is going to tell us about trust. The slide, by the way, that Carl presented, who was a bit blurry, was also presented on the first day. So when you get the slide on the website, you will be able to find them again. Grant, I can't see you yet on my screen, but I know you are around. And if you would like to take the floor, the microphone is yours.
Thank you very much, Geraldine. Firstly, thank you to GS1 and everybody that's put this on. I've really enjoyed the last 2 days. It's great to be given the opportunity to present and be part of the panel today. A very quick apology. Max has had a family emergency and won't be presenting today, so unfortunately you're stuck with me. I'll certainly do my best. If we can go to the next slide. The first thing is I'm here to talk about a project that is deploying a system called Trust, and that's not a spelling mistake. It's pronounced Trust, but we spell it TRVST, and that stands for a traceability and verification system, which is exactly what it is. So with our partners, UNICEF have worked with the Global Fund, USAID, the Nigerian FDA, Rwanda FDA, the Gates Foundation, with funding from the EU Commission and Gavi. So under a joint initiative called the Verification and Traceability Initiative, we have developed this system. The system can verify products and it can also track and trace them. It is completely GS1 standards compliant. And in fact, at the heart of this system is an EPCIS traceability system. So the idea of the system is, if you look at the diagram on the right here, we receive the serialization batch data and serial numbers from a manufacturer into the Trust repository through a standard API, so a standard integration. And then countries can use verification tools such as mobile phone applications, either those developed by us or in an example from Rwanda using their verification application. Or in Nigeria, we're linked to their national product catalog. So we can link to different endpoints, different verification tools. Using an open API, they scan the 2D data matrix and then send us that data, and we can verify the authenticity of that data against the information held in the Trust repository. So those that are familiar with Europe, it is not dissimilar to the European verification model. It has some differences, but it's similar. In addition to that, it has a very powerful dashboard, which will then show you where the products are, where they physically are, where they've been scanned, if there's been any verification failures, and also suspect activity, which I'll come on to in a moment. So that is a very high-level overview of Trust as a system. At the moment, our main use case is to detect and reduce falsified medicines in low middle income countries. We also want to increase supply chain visibility and traceability. Obviously, the more products that we scan, the more that we can capture and the more visibility we have of where these products are. And also if they're in the wrong place, perhaps they're in a country they shouldn't be, which might suggest theft or illegal diversion. So as well as the product traceability and verification side, we're also using the GS1 standards, GS1 Digital Link standards, to provide electronic leaflets. So we have a resolver set up in the system. So you can see this is a photo of the application here. And if you scan the barcode, you can press the leaflet button, and then we will provide the electronic leaflets. So as well as track and trace and verification, we can also provide electronic content back to the user. This is particularly interesting when you think about the challenges of some of the markets we're working in. This project grew out of COVID, and at the time, I think all COVID products were shipped with English-only leaflets. And so this is an opportunity to provide country-specific leaflets or tailored information to the users. Obviously, one of our big goals is to promote the use of GS1 standards. We're completely GS1 compliant within this tool. And it's designed and deployed in partnership with countries, manufacturers, and donor organizations. We see ourselves as a platform to increase knowledge and experience of traceability, in many ways trying to accelerate the adoption and use and trialing of the standards and gain knowledge and experience. We meet countries wherever they are on their traceability journey. This is really important. We are not a national track and trace system. What we do is provide the tools to collect the serialization data, carry out verification and interface down to national systems. So if you were on the call yesterday when we heard from Nigeria, Rwanda, we are linked to both of those systems and we are interfaced with the systems that they are putting in place. Or we can work with countries that have absolutely nothing. So this is an accelerator to starting to use standards. If we go to the next slide. Okay, so that's just a little bit about trust. Let me talk about the current status. So this is actually a screenshot taken from the trust dashboard, and every green dot on there is somewhere in the world that has used the trust application to scan and verify a product. So we are currently live in 3 countries. Those countries are Nepal, Nigeria and Rwanda. So those countries are live and operating with us. And we're actually operational in a 4th because we had Mozambique that have just started scanning. We suspect that they're just testing out the system. They've downloaded the app. So very low volumes, but they are starting to use and experiment with the system. So we're live in 3 countries and we're operational in 4. We're preparing to go live in Botswana in Q4 this year. We have a trial plan this year and then hopefully full go live next year. So what products are in the system? Well, at the moment, over 65% of UNICEF procured vaccines are in the system and uploaded. And we have a commitment from vaccine suppliers to get this up to 75% of all UNICEF procured vaccines by the end of this year. So what does that give us as a community? It gives us a massive library of serial numbers and physical packs with 2D data matrix barcodes on. Because without those 2 things, countries can't start on their journey. If you're putting systems in place, if you want to trial, then you need a resource to be able to scan and reference data. So certainly that's one of the things that Trust provides. In addition to the technical solution, we also have a legal contract now that anybody uses the system signs up. And that means that everybody knows the rules of how to use the system. And more importantly, what data is being shared, who can access and see that data. So all of the data governance and data access protocols are all governed within that legal document. And everybody that uses the system signs up to that. We have over 11 million serialized items in the system. That grows every day. And we've verified packs containing about 2.6 million doses so far. The system is also very stable. It was built and deployed by the same organization that runs the European Medicines Verification System, which is the largest verification system in healthcare in the world. And we're now to the point where we have 0 false alerts in Nigeria and Rwanda. What that means is that all of the packs that are being scanned are all verifying successfully. We have no false alerts. So that means if we did get an alert, it's very serious because that could mean that there's a potential falsified product. Just one quick story. Just the other day, we had an alert through the system where the exact same pack had been scanned in Uganda and Nepal. That would suggest that that physical product has moved between those 2 countries, or, which would be unusual, or that one of those 2 packs is fake. And that's the type of thing that the system can do. In that particular example, we understand that it was a UNICEF member of staff that had a pack in their pocket. They've moved from one country to the other. They were just demonstrating the system, but it did cause an alert. So that shows you the power of the trust system to be able to look at illegal diversion or product movement across countries. So what's our focus for the next year, the next 12 months? We want to establish a strong pipeline of new countries. And if you're from a country and this is interesting to you, please do reach out. We do have complete onboarding processes. And as you can see, we're already working with Botswana to get them live this year. So wherever you are on your journey, if you have absolutely nothing, or if you already have a product catalog or something, we can work with you and integrate trust into that very easily. So we want to get a strong pipeline of countries. We want to expand beyond vaccines because the system will work with all products, and we're currently partnering with the Global Fund to look to see if we can bring some other products into the system this year. And then we're always up to enhance the system for other use cases and functionality. And then finally, we are working with the TIOP, the TOIP project, to make sure that we're compatible with the standards and the guidelines that they're going to be bringing out. So that's my 2 slides. If we just go to the next slide, I'm not going to present it, but just to let everybody know that both Max and my contact details are on that slide, okay? So if you do need to contact us, by all means, reach out. Okay, thanks very much. Back over to you, Geraldine.
Thank you very much, Grant. So the next speakers are Linda, Beth, and Joe, and they are going to tell you about a kind of new initiative. So we heard about it already, but not with so many details. So I'm looking forward to see the details of the tie-up initiative. Linda, Beth, and Joe, the floor is yours.
Great, thank you, Geraldine. Next slide, please. So now that you've heard Perrin Beer talk about the global donor vision for improving end-to-end visibility, and WHO talk about using standards for their SMART guidelines and the PCMT, and even Grant with UNICEF talking specifically about the trust solution and verifying vaccine serial numbers. Hopefully now you can start to envision a future where our trading partners, be they manufacturers, freight forwarders, country regulatory authorities, and our supply chain operators can share traceability information in response to national regulatory authority requirements with fewer connections. So whether we're talking about use cases for patient safety, for supply chain efficiency, or even product recalls, we need a safe space to talk about use cases, to draft requirements for the key data elements that we need to exchange. And then we need to build and test and then update our standard documents for everyone in the global health community to learn and adopt. So that is what the Traceability Interoperability Platform, or TIOP, or what we Americans say is TIOP, is all about. Next slide, please. So as you've heard over the past few days, many African countries have already drafted and passed, and in some cases, legislation requiring the use of GS1 standards as part of their national traceability strategy. But now we need a platform that will allow key stakeholders to talk about our requirements, to test out our ideas, and to document our work, and then pass that information on to the community as a global standard that will allow the marketplace, including technology providers, to approach traceability in a more nimble, cost-effective, and scalable manner. So TIOP is about moving event messages from one trading partner to another. And our phase 1 use case is about exchanging that commissioning, aggregation, and shipment data between trading partners. So I'll let my colleague Joe Shobe with the GHSC PSM project tell you a little bit more about the specifics on how TIOP currently works. Joe?
Thank you, Linda Beth. Next slide, please. And I might have a little tough time with my internet connection. I'm down in Zimbabwe on assignment, but let's get started. So this is a diagram of the TIOP platform, and TIOP is essentially an EPCIS document broker. Normally in the EPCIS information exchange, trading partners can query up and down the supply chain to get information that they need for their own EPCIS repository, so that they can continue to track the activity of the products by serial number across the supply chain. And so what TIOP is intended to do is to provide a single point of contact for countries with a standard message that allows them to connect to multiple suppliers. And so TEOP is doing the work of onboarding those suppliers through a standard onboarding document that centers around a message design or a document design. And then it enables us, it enables the manufacturer to share that information directly with the country's national traceability system. So TEOP is built on open source tools, and it incorporates all of these components that include capturing the EPCIS document from the supplier, bringing that document into the TEOP platform so that it can verify that this document is authorized to be shared with a particular country for this product. So we use a trading partner directory and a product master inside TEOP to build business rules that link the supplier with the country across this product. We also have routing rules inside the tool that allow us to describe how we connect with the country's traceability system. And TEOP founded on, or is built on EPCIS version 2.0, but we can accept version 1.1 and version 2.0 documents. We understand the requirement of the country and then can transform that document from one version to the next in order to meet the requirements of either the supplier or the country. So suppliers could provide 1.1 documents or 2.0. The country could be on 1.1 or 2.0, and then we test how we need to convert that document for the specific destination. The platform also includes an EPCIS repository of its own for the procurement services agent so that they can monitor the activity through TEOP, see shipments that have been actually delivered to country, and interrogate the content of the events in that message. So initially, as Linda Beth pointed out, we've designed this for getting the serial information, which is a copious amount of information on many shipments directly into the country's traceability system. And so we've designed it for the commissioning, aggregation events, and the shipment events. And the community has gotten around the actual design of that message, of that document, so that we're meeting the country's requirements for the information that they need, and we're meeting the supplier's requirements for the information that they need to provide, and all in a standard format. So next slide, please. So to date, we've onboarded 2 ARV suppliers. We're in the throes of testing end-to-end between the suppliers providing documents, TEOP performing its work to authenticate and validate that document, and then transform and route that document right now to Nigeria. We have Nigeria onboarded, and we're working on getting Zambia onboarded. And so the goal is that within really the next few weeks, we're getting ready to turn this on for specific shipments that we're tracking that are going from our suppliers, from these suppliers into these countries. Some of the biggest work that's been done to date, or should I say some of the heaviest lifting, has been to work across the community to get a good design for these documents. So we're in an unusual environment, really from a standards perspective, that we're, we have a procuring agent that's buying on behalf. And so the supplier is providing information normally to the person to the organization that procured the goods, but we're now routing this information both to the PSA that procured the goods and to the country. And so we've collaborated with the GS1 community and others on this call that have plenty of experience working in this environment to get the document design and to get the functionality that we're looking for to support the event data exchange. We'll be publishing, we have published the source code on GitHub. And within the next few weeks, as we complete our testing and our initial use of the tool with countries, we'll be completing a broad set of documentation that will be posted on the website that you see listed here. So let me hand it back to you, Linda Beth.
Yeah, thank you, Joe. So can we go to the next slide, please? Okay. So great. Hopefully now you've heard how TOP phase 1 is working and about the results that we have seen to date. Hopefully you can start to understand how we can use TOP to test ideas and to and new use cases for publication for the global community. So through the TOP platform, we can come another step closer to that end-to-end visibility that Perenbeer discussed, and understand how the TOP can support the WHO and their vision for standards-based solutions, and even how trust can be a consumer of the TOP learnings around data exchange for new use cases. So all of this we do in the name of patient safety and regulatory compliance. I'm happy to answer questions now or in the future. The next slide will have my contact information. And for the moment, I will turn the microphone back over to Geraldine for the next part of the panel. Thank you.
Thank you very much, Linda Beth, Joe, and thank you to all the panelists. So this is the end of the panel. And for those who are not familiar with this EPCIS standard, which is not so often used, it is a standard which allow you to have real-time information about where your product is on the supply chain. So as we keep on talking about visibility, this is really the key standards to enable visibility. And if you want to know more, you come to one of the panelists or to Nuran and I. So now it's time for questions and answers. And I invite you all to use the Q&A function in the chat in order to be able to ask your questions. Donc, utilisez vraiment la fonction de questions-réponses dans le chat pour pouvoir poser vos questions et on passe aux questions. Donc, ma première question sera pour Parambir et pour Karl. Je vais la faire en français et ensuite je la traduis en anglais. Donc, est-ce que vous pouvez décrire en quelques mots quels sont les éléments clés pour permettre aux initiatives qui sont proposées par votre organisation d'être déployées dans un pays? So can you describe in a few words what are the key components to ensure the deployment of the framework established by your organization in a country or region? I think it's important, as you've listed a few ones in your presentation, for countries to know how they can benefit from this and if you have any prerequisites in the country. So I will go to Parambir first.
Thank you, Geraldine. So one thing that we've done is we've put this in our supply chain technical brief. That's the document that I had referred to earlier, is that we've taken a comprehensive approach to ensure that, there is a all-around improvement of the supply chain information systems. In that, we have said there has to be, and I'm so happy to hear Carl mention some of the same things. It's amazing. It seems we were thinking alike. We have asked for an enterprise architecture-based approach. We have asked for regular assessments of the information systems maturity in country, along with the support that we have for GS1 standards. So one is the adoption of GS1 standards as a policy, as a regulation in country. The other part is the implementation or adoption of GS1 standards within the information systems. And that's where you have exchanges with, manufacturers and so on and so forth. We also have, having said all that, we are also focusing on workforce development, just to make sure that they are also aware of, GS1 standards, how they interact with the supply chain information system. So it's pretty much a comprehensive approach, and then comes the part of the guidance and so on and so forth. A part of that is being brought out by WHO and, working groups such as TraceNet and so on and so forth. So, that's kind of there, but in practical terms, the support, as I said earlier, comes through strategic initiatives by Global Fund and through PRs requesting for, setting aside budgets in their allocations for this purpose. And for that, they can work with the country teams from Global Fund to get more guidance. So I'll take a pause here and hand it over to Carl. Carl, if you would like to chime in. Thank you. Over.
Sure, happy to. For WHO support, one of the first steps to take is to send a letter to the WHO country representative, just to let them know that you're interested, and that can help facilitate support through WHO. We also are working closely with the donor agencies, for example, those represented on the panel today, to align the approaches that we're taking. I think the ideal scenario in a lot of cases would be that some of the investment opportunities that are represented align with the WHO specifications and guidelines, as well as some of the other ones that were presented today. I will put in chat sort of the basis for the way we approach digital investments. That's the Digital Investment Implementation Investment Guide, the DIG, which does provide a general approach for digital investments that you can take, including looking at enterprise architecture, governance, and policy, as well as the infrastructural and IT aspects. I would suggest that as a starting point, and it's a basis for the other handbooks that I mentioned earlier. Everything that we have is open and publicly available. Please feel free to reach out to me if you would like any further details. Thank you.
Thank you. Thank you both for these very pragmatic answers. It's very helpful. So the next question will be for Linda, Beth, and Grant, so you can already warm up your mics. And you have both presented two initiatives, which sounds very promising in terms of being the catalyst for traceability in a country. Can you explain how they are connected? Like, how does it work? Do they overlap? Or do they work one after the other? Can I use simultaneously both in my country? This will be very helpful. Thank you.
Sure. Linda Beth, do you want to? No, I'll go first. Okay, no problems. It's really important that trust and TIOP are not competitive in any way, shape, or form. I think that when you consider the supply chains that we're talking about, they are different to the private supply chains that you might have experienced in countries like Argentina or Turkey or UAE, or any country that has done track and trace to date. So why is this environment different? Well, there's several elements I can think of. The first is that products are procured by a third party on behalf of perhaps a government, as an example. So they're physically procured by somebody else than where you're sending the goods. And in a private supply chain, that's less common. Typically, the person that's procuring them is the one that then receives them. The second one is that the actual funding of that order can be by a different third party. So the person ordering it isn't necessarily the person that is ultimately funding that purchase. And the third big difference for me is that the supply chains, there can be pre-country supply chains. So goods might be, for instance, delivered to a big UNICEF warehouse, and then they go from that UNICEF warehouse to the country. So if you think of legislation in Turkey and Argentina, a lot of their standards and ways of working only cover what's going on inside the country. They don't really account for the pre-country supply chains. So there's just three examples where our supply chains and ways of working are different. And therefore, as a community, we can't just pick up what's been designed for Argentina or Turkey or UAE or Europe and just use it. We need to find additional ways of using the GS1 standards with different roles and responsibilities, perhaps slightly different data models, etc. And that is one of the things that TOIP is delivering. It's saying, okay, let's look at these use cases. Let's look at the stakeholders. How do we work as a community in order to meet everybody's needs? Okay. And we use good practice that's been written by other people, but then add our flavor to it. Okay. Now, trust needs that because trust works in that environment. The manufacturers need that because they supply into that environment. The countries need it because they're going to receive it. So what we have here is a community effort to produce guidelines and what we call a technical architecture, not a system architecture, a technical architecture that says what data, what business processes, how does this all link together? The output of that is interoperability. And that's what we all need. We need to play in an environment where we can all talk and work together. And there will never be one traceability system. There will always be lots. Manufacturers will have different systems. Countries will have different systems. The middle people will have different systems. The important stuff, it all sticks together, the glue. And TOIP will give us the glue. It will tell us how to do that. So that's the first thing. It's not competitive. The next thing is that how about trust and TOIP? Well, sometimes people might put data into trust and we send it through to TOIP. Other times data might go into TOIP and it comes through into trust. They will be interoperable both ways. We will take the outputs of TOIP and we will build it into functionality in trust in future. So that way we'll be flexible. We don't know what 3, 4, 5 years look like, but we'll certainly make sure that everything is interoperable. So it's not competitive. And over time, we'll find where these different systems land. But fundamentally, you know, we need that architecture that we can all work to. So that's a little bit from my perspective. Linda Beth, I don't know if we want to expand on that, or Joe, if there's anything else you want to add.
No, Grant, you actually did a great job answering that question. So, I mean, maybe I just add a little bit that, you know, we did recognize because we participated and we still participate in the trust steerco that, you know, there would be manufacturers, there would be processes that would fall outside of trust. And so, you know, the TOP initiative is really just a way to document those additional use cases. We really are hopeful, and I think you heard Joe mention that we're using open source tools right now. This really initiative is really about building out those requirements, and we are hopeful that, you know, technology providers will take the learnings and actually build it into their own tools, and eventually, you know, the TOP can go away. It really is about enabling the community around traceability and just giving us a place to start to kind of test it out before you or before a country builds out the requirements for those additional use cases to then put that, you know, RFP out on the street. So it's right now, it's just a way for us to build that community. And then hopefully as technology providers take this on and learn more about those use cases, you know, the TOP won't be needed as much. But yeah, great answer, Grant. Thank you.
Yeah. The other thing, the trust team sit with the TOP team writing all this stuff. You know, we're not separate, but we're completely working together. And it's my hope that in future, once we get some outputs from the TOP, I'll be passing that back to our solution provider and just making sure that everything that we do inside trust is compatible and compliant with what we've said. We are an EPCS engine, if you like. So we'll adopt those standards and things and make sure that trust can work in accordance with those TOP guidelines, which, you know, and then that will be available. So thank you.
Thank you. That was a very enthusiastic and detailed answer. So I will go for a last question to all the panelists, and then we take the live Q&A if it's fine with you. So Carl started to explain that we can send letters. Grant, you shared this slide with email address. So very concretely, if I am in a country and I need assistance, so I need resource, I need funding, how do I reach out to to each of your organizations, and what is available to me at the country level? I don't know who wants to start. We go with ladies first, and Linda Beth, you.
Yeah, thank you. So we do have USAID missions in most countries. So that would be, you know, the first place to start is, you know, to contact the USAID mission, they'll likely put you in touch with our supply chain activity managers, and they oversee the supply chain activities and the commodities that we procure for each country. And they also oversee the technical assistance that we provide for a country. So if you can reach out either to your USAID mission, or even we typically, in a lot of cases, I will say all, in a lot of cases, we do have our implementing partner will have a field office there. That would be also another good way to contact them. And then we can either work with you in terms of your country technical assistance, system strengthening. And then the TOP initiative is actually from our headquarters, but we do work with countries who are prepared to adopt or to take on a use case and work from that. So I would just start with the USAID mission, and then happy to help. Really very excited to participate as everybody's maturing to figure out how we can help you. Thank you.
Thank you, Linda Beth. So I see Carl is starting to post things in the chat. So you're ready for answering next, please.
Yeah, sorry, that was a little premature. But I put two things in chat. One is an email address, smart@who.int, that will get you to us at sort of WHO headquarters and the initiatives that we have there related to supply chain and smart guidelines. And the second is a link to the AFRO list of country offices. And if you click on your particular country, you can see the WHO representative contact information there. So that should get you connected. If there are other regions, happy to put the links in the chat, but I think this is mostly an AFRO Francophone conference. Thanks.
Thank you. Thank you very much, Carl. I'm sure everyone is now adding these links to their toolbox for next step. And Grant seems to be volunteering to be next. So please go ahead.
Yes, very similar to Linda Beth. I've just put in the chat Max's email address. If nothing else, reach out to Max. He will put you in touch with the appropriate people. Or fundamentally, you contact the local UNICEF office and they will then work with Max and myself. What we have is we have a standard blueprint onboarding model for any country. And within that, there is the enterprise agreement. That's a contract that everybody signs in order to use the system. We build a technical roadmap of how you're going to use Trust and how that does or doesn't interface with anything you've got locally. So if you've got nothing, you can use our mobile app. If you've got a product catalog, we could link to that. So there's different options based on where a country is on their journey. So we've got the contract, we develop a roadmap so we know how we're going to work with you. We've got a template project plan. We've also got some funding in instances to support local initiatives. And then finally, we talk about how to enable your supply chain, because you're going to need some scanners on mobile phones. So with those things, we then lay out a project plan. That's exactly what we're doing with Botswana right now. And then we can bring a country on board anything from 2 to 6 months, depending on the type of engagement and deployment. So yeah, number one, contact Max, or number two, contact the UNICEF office, and we'll work with you to get you onboarded.
Thank you. That's very clear. And last but not least, Paramveer, what about the Global Fund?
Thanks, Geraldine. Global Fund, I would strongly recommend that in-country folks reach out to the principal recipients of the grants. Sometimes there are definitely multiple grants, but reach out to the principal recipients. There is always a set aside for the health product and waste management systems. So that's one, and GS1 definitely gets covered under that. These are part of the grants that are made every 3 years. But feel free to reach out at any time. Either they will find funding in the current cycle, or we can have through the country teams, we can have a really good discussion and have something set aside for the next cycle. So please do reach out to your PRs, who will reach out to the country teams within Global Fund, and unfortunately, that's a huge long list of email addresses that I can't put over here. But feel free to reach out to me, and I can redirect you guys within the Global Fund. Thank you. Over.
Thank you, Parambir. That's very kind. So this is it for the questions that we had prepared. And now it's up to you, online or in the room, to take the mic or to use the chat in order to ask questions. So the first one is actually in French, but for the panelists, if you check your mobile phone, you should have the translation in English. So, est-ce qu'il existe à ce jour une évaluation indépendante de toutes ces initiatives en termes d'efficacité, de sustainabilité et surtout de sustainabilité financière, donc les coûts totaux, y compris les licences et les logiciels d'investissement. Donc, do we have any analysis on the efficiency and the sustainability, in particular in regards to the financial sustainability of all these initiatives, in particular in regards to the cost for license, software, etc. Who wants to take that question? I see Grant nodding.
Yeah, I'm happy to share where we are. So with regards to financial sustainability, this is a very topical question. Currently, Trust is funded through donations, so we're donor-funded initiative. At the moment, we believe that we have secured funds to allow us to run for the next 2 to 3 years. So during that period, we can ramp up, we can offer this service for free, and we can grow to grow the system. We are intending to kick off a piece of work now that looks at what would the financial sustainability model be of something like Trust. There are probably 4 or 5 different ways to fund a system like Trust, and it might be that we use a mixed model. So we are going to be carrying out some work to look at the sustainability models that we can then come back, because we're certainly going to have to put something like that in place in time for when the current committed funding runs out. Yeah. But the good news is we don't have to worry about that for the next 3 years. We'll be working that in the background. At the moment, Trust is donor funded. It's available for us to carry on using and exploring and gaining the benefits from.
Thank you, Grant. Anyone would like to add to this answer from their own perspective? Yes, Linda Bess?
Yeah, thank you. So maybe just to follow on to what Grant was saying, this was and has been a consideration. I don't want to say the assessment part, but the financial sustainability since before the Trust was even stood up. As the SteerCo started to meet, we were trying to understand how would it be, how could it maintain itself in perpetuity, and then other solutions, the same question. It can't really just be dependent upon donor dollars, because those ebb and flow depending on what our programs are funded to do each year. So we do expect, as part of that governance process, to look at what does sustainability look like, and does that mean there is a fee associated with each item that's and each serial number that's in the solution. We're looking at different economic models to help that would help fund it. Is it do you pay to decommission serial numbers at the end? Really, or pie, that we're looking at the sky's the limit right now, looking for ideas in terms of what that economic model might look like. And there could be a couple different, depending on different technology providers and what different countries are looking at. So we're definitely still in that investigation phase, if you will, but really happy to discuss this as a community to make sure that whatever suggestions we put in place they actually work for all of our stakeholders. Over.
Thank you very much, Linda Bess. Carl Parambir, is it a question you feel comfortable? Yes, Carl, go ahead.
As I mentioned before, the handbooks and everything is open and freely available. The product catalog management tool, if you are interested in making use of that, the one that WHO is hosting, it is an open source tool, but it's also, as a member state of WHO, you would have access to it without a fee. So if you want to host it in your own country, it is open source. Feel free to make use of it. We don't have a lot of implementation funds, so you would need to look at putting investments into if you want to host it yourself, or look at the larger work that needs to be done around business process and change management, some additional funds for that. But in terms of the PCMT itself and using it, there's no fee. Over.
Thank you. Parambir, you mentioned different initiatives. You also said that there is an envelope that is going up for 3 years. Anything from your side?
So just to supplement what Carl said, Global Fund does provide implementation funds. Global Fund does provide, funds that will ensure operations and maintenance of various systems in country. And there are different mechanisms, but the main one, I just have to repeat the same thing. It's best to have it within the grant and, do talk to the PR. But, there are funds definitely set aside for everything from from health systems to supply chain information systems. All of that is there. That's why, I'm just one little part within the Global Fund. My focus is supply chain information systems. The PR would have a really, really broad focus where you could look at implementation resources, so financial resources for implementation, financial resources for implementation of health systems, of supply chain information systems, financial resources for workforce development, financial resources for policy, and so on and so forth. So, that's your whole bouquet of services that you can kind of, or avenues that are open to you. And then you can probably use tools like TOP or Trust and the PCMT in country. Thank you. Over.
Thank you, Parambir. J'espère que ça répondait à la question. C'est une question assez large, mais vous avez compris qu'il y a différentes options en fonction des différentes organisations et que dans tous les cas, c'est quelque chose qui est déjà planifié et bien prévu par chaque organisation. Donc, il s'agit ensuite de trouver les points de contact et de choisir dans les menus disponibles les options qui sont pertinentes pour un pays. Alors, je vois qu'il y a une autre question qui est aussi une question assez large et qui est relative aux difficultés que les pays rencontrent dans leur développement et comment ils arrivent à les mitiguer. So the next question is related to any challenges that countries are meeting in their development and how they manage to overcome these challenges. So it's a kind of wild question, quite large, but we still have time. So who would like to go first? This time I'm not doing lady first, so okay. Thank you, Parambir.
Yeah, I think that's a question that is very, very pertinent. There are a host of challenges, and that's where, we have a very distinguished panel right here. We can say countries at this point are in a way lucky that they can leapfrog certain technologies. They can benefit from learnings from other countries, from other experiences that have already happened. They can call on this this community of practice of donors who are always ready and willing to provide that support. Support comes, as I say, in financial resources for implementation, financial resources for workforce development, financial resources for redoing or upgrading the strategy and policy, governance, all of that, plus for health systems, supply chain information systems, and then the expertise and knowledge that is represented by the panel over here. So yes, countries have we also provide expertise or support in terms of literally first doing a ground assessment of or landscape assessment of where things are, from where the country can actually choose what is more important to them, and we can counsel them on that. We can discuss with them on that, and then have an optimal way forward, because there's only limited funds. I have to put that caveat there, that funds are not unlimited. So whatever funds are there, how best to use it, we can work out roadmaps, and then we can call on the community to provide technical expertise to leverage those funds and provide the best results for the country. Thank you. Over.
Merci. Donc, du coup, c'est plutôt développer une feuille de route et travailler avec le pays pour obtenir les fonds disponibles par le Global Fund, par exemple. Linda Bess, the floor is yours.
Yeah, thank you. Maybe just to add on to what Peer was saying, from our perspective, we've tried to start with education workshops, and then a strategy workshop in countries, because we know that this is a long process, and what we have realized is we really need countries to adopt regulation first, because that's the why. That when manufacturers, why would we label if there's no regulation in country? So we've really spent a lot of time the past, I would say 5 or 6 years, helping countries to draft that regulation, and then of course it's up to them to then push it through, and it does take time, and so in the meantime we continue to educate within country, to try to start updating software to enable capturing of some of that standard data, which we're expecting to start capturing once the regulation is in place, and even hopefully before in warehouses and whatnot. So we tried to take some of those steps in anticipation of that legislation happening, and I can even tell you, so there's kind of that big policy difficulties which countries encounter, and then specifically in implementation, as we've been working with the TIOP and trying to exchange that data between manufacturers and Nigeria's traceability system, we've even started to really dig in on some of the EPCIS standards, and having to build in extensions, because that traceability system wanted not only some event data, but a little bit of transactional data. And so having to kind of negotiate what on that very technical level, what data needs to be sent. So there's multiple layers, I think, to that question, but we're here to help and actually to learn some of it ourselves. As Grant mentioned before, we're really in a different sector, if you will, because we do have lots of third parties building into this, and that means that the standards don't always meet our needs. And so we are, as a community, if we start talking about what we need, and possibly do we need to push back and try to change the standard, then let's have that conversation. So I just think there are layers to that question. I don't know that I've answered it, but maybe I've helped explain some of the difficulty in it. So thank you.
Thank you very much, Linda Best. We will know in a few minutes if you answered it, depending on whether we see another question popping up or not. In the meantime, Grant, the floor is yours.
Yes, thank you. If I put myself in the position of being a country, as we've already said, I'd like to build on what both Parambir and Linda Beth have said. This is, this could be a 5 or a 10-year journey to get to traceability. Nobody's done it much faster than that. So it's a very long journey. And at the start of that journey, it's going to look like a mountain, isn't it? Where do you start? And really, where are the challenges? Well, the first thing is to really understand, why are you even taking this journey? What are you trying to achieve? What problems do you have as a country? I'll give you a very simple example. We had a country, and I won't mention who they are, but they were a European country, that they reimburse their medicines. So you go to the pharmacist, you pay a small fee for your medicine, but then the government reimburse that pharmacy. That country had €1 billion worth of fraud in that process. €1 billion of fraud in that process. That was their use case to do traceability and verification right there. They understood their problem. Once they solved that, they then expanded that system for supply chain visibility and very many other issues. So, you know, I think that the first thing is these countries, they have to know what their problems are and build a strategy of why they're going on that journey. Now, in doing that, they've then got to sell that to a lot of senior people, government and people like that. And that's a difficult task, to go and sell this story. We're experts. Sometimes we have trouble explaining it all, right? So you've got to, I think countries need to gain support. And one of the things that we can do through the initiatives and the funding that's provided is we can run pilots, trials. We can actually show people, you know, we can, for instance, we could get trust up and running like we've done with Nepal. Now you can bring your officials and your governments and your regulators along and say, hey, look, here it is, right here, working. We're not saying this is the solution, but look, you can see it now and it's live, it's possible. Gives you a little, it gives you something to sell. It gives a little bit of hope. And then, you know, as a country, you're going to have to build knowledge and experience. You, unfortunately, you're going to have to become subject matter experts. And once again, the initiatives and the tools that we provide hopefully help you leapfrog and give you opportunities to go and trial something. You know, if you go back 2 years, nobody was scanning UNICEF vaccines anywhere in the world. But now we have barcodes on physical packs. We've got scanners, we've got data. You can trial it. It's free, you know. And at the end of that, you'd have learned a lot. You'd learned a lot about the standards, scanners, all sorts of stuff that if you hadn't piloted, you wouldn't know. So I think this is a journey. Definitely we need regulation, but regulation can take 2 or 3 years. In the meantime, you can do stuff. You can run pilots and trials and things like that. So that will even inform your legislation. And so by the time the legislation is passed, you're in a much better position to, you know, to take the next step on that journey. So I think that this is the type of thing that we bring to the forum. And I admire all of the countries that are involved. They're incredible work in this space. You know, from yesterday and the day before, we saw some amazing people, you know, really on that journey, and we're really here just to support them, really. Thank you.
Thank you, Grant. And indeed, you are all superheroes. And I can still see hearts and things popping up on my screen. So I guess it's for Grant and not for me. But anyway, I won't be upset. You're raising your hand. Go ahead.
Thank you, Geraldine. I just wanted to take a point that Linda Beth made and the one that Grant made and bring home something that, you know, yes, there are challenges. And, you know, as Grant said, hey, countries have to identify their challenges. And as Linda Beth said, that, you know, we have to then have alignment sessions as to have a common understanding of those challenges. But I'm taking a step further back and saying just the comprehensive identification of those challenges and then providing solution options or alignment, you know, assistance to align on roadmaps, that is also available through grant funds that can be asked for. And then you can have it spread across, you know, different sectors of this, you know, health sector, supply chain sector, policy, workforce development, all of that. And then that's what I was referring to. You can pick and choose what is more critical. You can lay out through those consultants a 5-year timeline or a 10-year timeline and work with various donors as to how to get there. So, you know, just laying that foundation, identification, and then seeing what are those options. There is support for that also. Thank you. Over.
Thank you, Barambir. And I think, Tom, in the next panel, is also going to explain this effort of coordination and prioritization, which is critical. Carl, you haven't said anything on these questions. Would you like to share a few words?
Yeah, maybe just to reemphasize what Linda Beth mentioned about the governance and the policy. That is really the driving factor or the limiting factor, if you will, if that governance isn't in place. And it's not just about the legislation, it's also about making sure that there is the organizational structure within the ministry, within the FDAs, of the people that will actually take on the responsibility in ensuring those policies. are put into place. You know, if there is a product catalog, that make sure that there's somebody that is a product catalog manager that can link with the appropriate organizations that have a touch on the data. I'd say there isn't, when we think of supply chain data and product master data, it's not generally a single source of what that data is. It's really multiple sources that need to be brought together. And that does take time and effort. And while we can address things at global or regional level, there is still local codings and local products, local manufacturers that need to be brought into the mix. So I'd say that that is an important step to make sure before you get into the technology, before you get into even the information standards, is just making sure that you have the people in place and the organizational infrastructure to take on these activities. Thanks.
Perfect. Thank you very much. So this is the end of this panel and we are on time. So thank you also to the panelists for helping me to manage this panel, to prepare, etc. Thank you to Nuran for her support. So you heard about the fact that just by being here, taking the time to listen, we are very proud of you making that first step, but also for countries who have started, please keep on going. It will not be a piece of cake, but it's definitely worth the effort. And you heard from Lindebest, Grant, Carl, and Parambir that you're not alone. You have all these organizations here ready to support you, and they have been very pragmatic in explaining how to ask for help and where help is available and for what. So please do not hesitate to reach out. And you also understood that it is a question of maturity. Grant explained that you have different options for trust. Carl showed this level and the different maturity from 0 to 5. So it is important to acknowledge the fact that, yes, you will start from scratch, but you will grow and you will learn and you will achieve the objective that you will have defined. So thank you very much for this. Now we stop for a stretch, water and a coffee break. And we come back at 3:40. Donc 3h40, on se reconnecte. Et je vous remercie à tous. Thank you very much.
Merci beaucoup. Thank you, Geraldine. Thank you,
Merci à vous
Nuran. Thank you,
tous.
everybody else. Take care.
Hi, Al, can you hear me?
Yes. Can you hear me?
Great. Can we just quickly do a sound check?
Sure. Yeah. How's my video? It's good?
Yeah, can you say just one more sentence so we can hear it for the interpreters?
Yes. Can you hear me?
Yes, I
Good
can
morning,
hear
good
you.
afternoon.
Great. And Tom, DG Moji, are you able to unmute?
Yes, good afternoon.
Good afternoon, perfect. Can we also see your camera?
Hello.
Wonderful. Perfect. Thank you.
Thank you.
Thank you. So we'll just try. Tom, can you hear us?
I'm here. I can hear you.
Perfect.
Good
Okay.
morning. Good afternoon.
Good morning. Good afternoon. Okay, so we have about 3 minutes left in our break. And then, Tom, we can just hand it over to you to get started.
No problem.
And so we are just waiting just for one more person, Trish Long. But otherwise, we have Dr. Shabi here, and then Al and DG Moji as well.
Hi, Anja. A quick check. Did you send the link to Trish? Or you just send it to you?
Yes, no, I sent it to Trish as well.
Oh, she's
Hi,
on.
you.
I see.
This is Trish. Can you hear me?
Yes.
Thanks.
And Trish, can we try your camera just to see if...
Yes. Sure, happy to.
Okay.
How does that
Perfect.
look?
Great. And just for one more for sound, can we hear you once more for sound?
Of course. Can you hear me now?
Yeah, that's good. Thank you.
Okay.
All right, so we'll be starting in about 2 minutes. And so Tom will kick us off, and then we'll spotlight all of you as he starts the introductions.
Sounds good.
A few minutes.
No,
Tom, we are ready to start. And so hopefully everyone's coming back to their desks where they are remotely. Here in the we're trickling back in, but Tom, over to you.
Great. Thank you. Well, we'll give everybody just a moment to find their seats here because we're going to kick off this session. Let me wish everybody a good morning from Washington, D.C., and certainly a good afternoon to all my friends in beautiful Africa. And it's really wonderful to be here. My name is Tom Woods, and I'm sure I've met many of you over the years at these GS1 events and other events. It's fantastic to be here for this third Francophone Africa GS1 Healthcare Summit. Now, I chair something called the Global Steering Committee. You can see it on your screen. It's the Global Steering Committee for Quality Assurance of Health Products, or just GSC for short. And this is a body that's made up of really all the big donor institutions that procure medicines in partnership with African countries. And these large donor institutions are joined in the GSC by a private sector advisory council. So that's made up of pharmaceutical companies and technology providers. And they really, over the years, have offered a lot of good insight as we discuss among the donor institutions. But I would say most critical to the GSC and most unique about the GSC as a platform, a coordinating platform, is that we invite the African regulatory agencies to the table. So they have a seat with us, with the donors, with the private sector, together with the regulators. And this is so critical because we need that voice. We need to understand what's happening at the national level. And especially as we know, the problem of falsified medicines, theft and diversion, all the things that impact on supply chain visibility, well, they've never been a greater challenge than they are right now. Now, I had a chance to catch some of the last session, which was really wonderful. And we're going to try in this session, I think, to take a little bit of a step back and get a bigger picture of things. And we've heard a lot, I think, on the technical side about increased supply chain visibility, supported by global standards, moving toward traceability. But there's really an important thing, I think, that can help make all this work. And that's political will. That's policy decision. That's senior level buy-in, so to speak. And sometimes we call it governance. But at the end of the day, it's about really alignment. It's about making sure that that top level push at a global, regional, national level meets up with the technical capability and capacity in a particular country. Now, we're lucky on this panel to have some serious experience in the room, and they're going to share their perspectives on this national, regional, and global effort to work together to help bring greater supply chain visibility. I'm sure you've all had your fill of presentations and slides, so I thought we would really just jump right into some questions. And I think you'll see the speaker bios on your screen as they come up, and I'm not going to take the time to read them. So the first question is going to go to a person that I think many of you already know, Professor Moji Adeyeye, who is Nigeria's Director General of NAFDAC. Now, she's chaired the African Medicines Regulatory Harmonization work, and she's helped NAFDAC grow by leaps and bounds, including achieving WHO Maturity Level 3 for her agency. Without further ado, Professor Adeyeye, my first question to you is, you hosted the historic GS1 African Healthcare Conference in Lagos, and during that summit, 25 sub-Saharan African countries pledged to pursue medicines traceability as a regulatory priority and to help ensure access to safe medicines. So as a champion, a global champion of traceability standards, how do you describe Nigeria's own journey? And what advice would you have for other countries who are initiating that same journey? Over to you.
Thank you very much, Tom. Thank you, GS1, for inviting me to this meeting. I want to also recognize the other members of the panel. This meeting is extremely important for us. From Nigeria's perspective, it was 2018 just less than a year after assuming the DG's position, that we were invited to the first African meeting in Ethiopia. And I couldn't attend because of conflict, and I sent my special assistant to the meeting. That was the beginning of our journey. And from that meeting, Mr. Wood said, okay, it would be great if Nigeria could host the 2019 one. And we hosted it, supported by GSC and GS1. Why were we so enthusiastic about it? Because we recognized our need in the country. Drug distribution was chaotic, very, very chaotic. And we needed to look inside and say, what is it that is going to work for us? But with the support of GSC and GS1 and other partners, the meeting became very successful. And just like what Mr. Wood said, 25 African countries signed the call to action. USAID also partnered with us as a country to start the traceability journey. Several meetings, workshops took place, and we finally got it launched 2020 by the Ministry of Health, the Minister of Health rather. But we got good advice from Mr. Wood right from the beginning that governance is extremely important. So we started, the steering committee that is headed by the chairs of the Ministry of Health and also NAFDAC, Director of Registration. And we have the traceability office, we have the technical working group. The bottom line is political will that Tom referred to. And the political will has to be based on realizing the need of each country. It is the realization of the need that we push, that could push the political will. So that was how our journey started. And the pandemic gave us a good opportunity where nobody could travel, but vaccines will be coming in. We just decided that we will try this. That is the political will. In NAFDAC, we are also fortunate that we have GS1 office in Lagos, Nigeria. GS1 collaborated with us. We signed an MOU with them. They trained our staff, and the rest is history, because we also started imbibing the training competency and whatnot. And we applied or implemented this training by tracking the vaccines. All the vaccines that came in through during the pandemic were tracked. We created the Traceability Information System, TIS. So we can go to wherever now to know which vaccine actually went to what local government in Nigeria during the pandemic. We were also the first to do serialization, because there were some vaccines that came without serialization or barcoding on them. We took the challenge. This is where the country, each country has to understand where they are, what they need, and then use that to push the buttons from wherever they will need to push the button. So we serialized the products that didn't come with serialization. And it was at the GSC meeting that that question came up. One of the GSC meetings, that what if a vaccine comes in without serialization? I said, oh, we'll look at that. And immediately I called my technical lead, Mr. Kayode or John. What can we do? When you are pushed to the corner, things that you think you cannot do, you will find out you can do it. But it comes with help rather from others, like Mr. Wood, like my Geraldine, and I've forgotten the name now, I'm so sorry, that's retired from GS1. From there, we started collaborating or using Reliance with other regulatory agencies. Ghana came to understudy us for a week. Other agencies have come to understudy us. We are now going to Bomra, Botswana, for 1 week to help them, because this is a continental issue in terms of monitoring substandard falsified medicines. We take most of our medicines from China and India, and they come with a lot of issues in terms of quality. Therefore, this is an African issue that needs to be approached continentally. However, all the 54 African countries don't have to do this at the same time. We just have to be very strategic in terms of which countries can do it, can be helped. We have to use Reliance. This is part of our own global benchmarking to make sure that others also get competency that they need. But like I said, it cannot be done at the same time. So we have been doing this strategically. In fact, we decided that we're going to have a baseline assessment rubrics for any agency that we want to mentor, so that there will not be hiding one's head in the sand thinking that it is easy. But it can be easy if it was, if NAFDAC, for example, the leading NRA, can guide properly. So we have this document that we just designed. So we've given it to Bomra, Botswana NRA, to look at is there a political will? What of the leadership in the NRA? The leadership in the NRA is extremely important. If the head of the NRA is not really buying into it, it's not going to happen. If you cannot use human capital, check for those that are capable within the agency, that are computer savvy, likes computing and whatnot. It may not happen. But all these things, rubrics, we have sent to Bomra, and they have responded, which means it makes our own mentoring easier. NAFDAC is open to helping other agencies. However, we have put these key bullet points together so that it will be much easier, and also the NRA will have a part to play. Whichever NRA that we are mentoring will have a part to play. So with that, we have, just to stop, at this point, that we are here to do Reliance, to ensure that at a point, we're going to have African traceability map, where if a product gets to Nigeria, is going to Ethiopia, vice versa, we'll be able to track and trace it. Now we are part of trust. If there is nothing in place in a particular country, and a manufacturer has already put their information on the global platform, that country may still be able to identify products. So it is a journey. We are not there yet, but we have come a long way. Thank you very much.
Thank you, DG. I think you highlighted some important things. First of all, you had to figure some things out. It wasn't just handed to you. That's really, I think, an important lesson at the national level. And mentorship. You've offered guidance and mentorship to other countries, which is instrumental, I'm sure, to learn from others who've gone before. Let me turn to Dr. Shabi. Nice to see you again. It's been some time since we met in Wilton Park. I'm glad that you could join the panel. We certainly appreciate the work that you've done, Dr. Shabi, as Director General of Benin's Medicines Regulatory Agency, but you're now wearing an additional hat, which is Chairman of the African Medicines Agency Board of Governance. And so I wonder if you could comment a little bit on how you think AMA, the African Medicines Agency, might contribute to this journey toward traceability in Africa. Dr. Shabi.
Merci beaucoup. Bonsoir, Tom. Je salue également ma grande sœur, professeur Mondi. Très content de te revoir cet après-midi. Et bonsoir à tout le panel. Je suis très honoré de pouvoir prendre la parole cet après-midi pour aborder cette question assez essentielle, la question de la traçabilité, mais au niveau voilà, continental, en parlant donc de l'Agence africaine du médicament. C'est vraiment une très bonne question et je vais embrayer sur ce que le professeur Maudit vient de dire tout à l'heure. Il y a un besoin urgent pour nous en Afrique aujourd'hui de trouver des solutions adaptées à notre problème de faux médicaments, donc de médicaments de qualité inférieure et falsifiés qui circulent sérieusement dans nos États. Et on est tous d'accord et conscients aujourd'hui que la traçabilité est un outil qui devra nous aider dans ce sens-là. Et quel rôle l'AMA pourrait jouer pour aider donc les pays membres, et pas seulement les pays membres, mais tous les pays d'Afrique, parce qu'en réalité, on n'a pas de frontières, les médicaments circulent. Donc, je pense que dans une première approche, l'AMA ayant pour responsabilité quelque part d'harmoniser la réglementation au niveau des États membres, ce serait déjà un premier pas que nous puissions adopter une réglementation qui favorise la mise en place des systèmes de traçabilité dans les pays. Et à partir de ce moment-là, nous pourrions suivre aisément, beaucoup plus facilement. Quand j'écoute l'exemple du Nigeria, ce qui s'est passé, tous les pays n'avaient pas la possibilité de tracer les vaccins qu'ils recevaient pendant la COVID. On les recevait, on les utilisait tout simplement sans en savoir plus, mais avec un système continental, avec un suivi au niveau donc de l'AMA, je pense que quelque chose est faisable pour permettre aux pays donc, qui n'ont pas les moyens de pouvoir tracer par eux-mêmes les vaccins ou les autres produits qu'ils reçoivent, de bénéficier donc de ce système mis en place au niveau africain pour justement s'assurer de la sécurité et surtout de la qualité des produits donc, qui leur sont distribués. Oui, je vais répondre en disant que l'AMA donc, oui, pourra réfléchir. C'est vraiment pas aujourd'hui la priorité tout de suite parlant, puisque c'est encore une structure qui est en gestation, n'est pas encore véritablement fonctionnelle. Il y a des pistes beaucoup plus urgentes pour nous que nous allons entamer bientôt. Mais oui, la traçabilité fera partie justement des éléments que nous allons mettre en place parce que la circulation des médicaments de qualité inférieure et falsifiés est une problématique qui nous tient sérieusement à cœur. Merci.
Merci beaucoup, Dr. Shabi. And we will continue to follow progress within AMA as you make this a priority over the years, because I think, as you rightly said, the issue across the continent is so critical, the presence of falsified and substandard medicines. Let me turn to my next panelist, Trish Long. Trish, now you've spent about 5 years with the Global Family Planning Visibility and Analysis Network. We all know it as the VAN, serving as the Data and Technology Project Manager. So this work has put you in really the vanguard, I would say, of building supply chain visibility in particular countries and at regional and global levels even. So could you give us a sense of some of the challenges that have come up along the way that have maybe slowed implementation, and then how we're all poised to expand this supply chain visibility moving ahead? Over to you, Trish.
Thank you so much for having me. It's a pleasure to be here. What I would say the challenges that we have faced are really in connecting systems between the three levels that you mentioned, Tom, between the global, the regional, and the national level. And we know that those challenges exist no matter what continent you happen to be on. In this case, in the context of the African continent, we have a special working relationship with Francophone West Africa, and we have a regional approach here that has been one of the ways that we have addressed some of these challenges. We know that our colleagues in West Africa are eager to collaborate, and I heard Professor Moji mention this collaboration as being a really critical element. So we think that that's one of the ways to overcome the challenges. But I want to get into just briefly, what does that actually mean when you talk about collaboration? What are the things you need to support the people and the technology in order to get them to work together? And those two things that you need are process and policy. When we talk about processes, whether we're looking at the global, regional, or national, they have to have processes to be able to utilize the information that are available in the system to figure out, for visibility's sake, where is my product? When is it coming? And this is just as applicable to traceability as it is to supply chain visibility. And that's where I think those two subjects really meet, is in the idea of you cannot manage what you cannot see. So you have to know where it is in order to be able to manage whatever issue you happen to be having with it, whether it's counterfeit or shortage or a need to move stock around because you have an imbalance in your system somewhere. The other thing that you really need is policy, and that is what you use to connect. It's one of the key challenges, I think, of working across these three levels, global, regional, and national. And that the policy I'm really speaking about here is data sharing, right? The ability to share data with one another and the ability to have a policy in place that allows people to be feel secure sharing data that they may feel is proprietary to their business, or that may contain personal information that might be something that a patient might not want you to see, or something that a client may not want you to see. Those are really critical policies that enable the people and the technology to coordinate for better visibility and ultimately, I think, for traceability as a goal. Thank you.
Good. Thank you, Trish. I'm sure we'll come back to you to delve into that a bit more. But let me now turn to Al Shafira. Al, you serve as a program manager at the Gates Foundation, but so much of your experience that you're bringing to this panel comes from your extensive field work, including helping the Ethiopian government with its digital health transformation. So I wondered if we talk about, and I think people have heard that, how do you get started? What are some of those initial hurdles that you have to clear? So I wondered if you could kind of tell us about some of the prerequisites and the sequencing that has to take place at the national level for a successful implementation of medicine's traceability. And drawing on your own experience, talk about this prerequisites and sequencing, please. You might be on mute.
Thank you very much, Tom. And it's a pleasure to speak again for the second time at this conference and with my esteemed colleagues. So I'll focus on the experience, as you mentioned, from Ethiopia, but then also just seeing what has happened across countries. I think the very first thing that I would very much like to mention or to share is that this is a very long game. I think for a while, we've not really done a good job in setting the expectation that this is something that could potentially be a decade or a decade plus work. So I just want to say that at the onset. But in terms of, the prerequisites, and then once you have those prerequisites, how do you sequence them? I like to kind of categorize them in basically three buckets. One would be on the governance. My co-panelists have already mentioned those. And even when we discuss on governance, so let me just go back. So one would be just governance, and there are a lot of components around that. And the second, I think, often overlooked is the communication part, the creating awareness and so on. And the third will be on the technology. So let me go back on the governance aspect. I think what has been done for the most part is setting some level of regulatory framework within often the FDA, the Food and Drug Administration agencies, and so on. But really, there probably are multiple levels of regulations that we need. And oftentimes we look at traceability within the health system only. It's sort of siloed. But in reality is traceability really has to be sort of a subset of overall country requirement. It may not be necessarily called traceability, but there really has to be a prerequisite coming from the country and being able to know what's coming and being able to track and being able to trace. So the regulatory or the governance framework should exist not just on the health sector side, but even one level above. So there's some level of connection and enforcement, reinforcement that could be that can come as a result. And there's that. And also, it's not going to be a one-step process. I think these regulations quickly get outdated because the technology, the reality on the ground changes. So just because we have managed to create one, it does not mean it is going to be as valid and as useful over a period of time. So it requires some level of continuous improvement. It's a bit tricky because, you know, governments or regulation processes don't go very quick, don't change often. So there's a challenge there. Second, I would say is very much on the communication end. Those of us who talk about traceability and track and trace, even as we find it sometimes a bit hard to process. And just imagine what this would mean for somebody on the outside. So a great deal amount of knowledge sharing, a great deal amount of communication at the top level of government, at the donor side, stakeholder side, and also the health workers are so important. A lot of times because we start at the high level and the awareness is easy to build just because there are fewer people at the top, it sounds easy, but I think wondering how a store worker feels about this issue is something that we've not looked for a long time. So that communication component has to go not just be at the top, but all the way down to the bottom. And the third section is on the tech side. We've talked a lot about product lists, and the previous panel had discussed on this as well. We found, at least in the case of Ethiopia, is having a master product list. We've heard it again for a while. When it comes to traceability, it's not even a nice to have, it's actually a must have. And it has to work in a very smooth and effective fashion. So that is absolutely, definitely something that is a hard prerequisite. I would definitely underscore that. And the sequencing, therefore, starts from this. And the other component I would mention on the prerequisite is ability to electronically share data from the suppliers to the country systems. Could be via the VAN, as Trish mentioned a few minutes ago, or could be some other way. The details we can discuss, or we can omit that for a moment. But an ability to share huge amount of volumes of data to country systems is so critical. So I would say these are the three big buckets, and then how the sequencing is going to be critical for us to be able to achieve this overall goal. Over.
Good, thanks, Al. Let me just probe a little bit deeper there. And you mentioned some key actors. You talked about health workers in form of communications. And you've talked about governance. Are there other key actors? And of course, the regulatory agencies themselves. Are there other key actors that you would highlight as essential to kind of this kicking off, or the prerequisites for success at the national level?
Mm-hmm. Absolutely. You know, the highest level within the health system, at least as far as the traceability is concerned, is often the Food and Drug Administration, as we have Professor Moji here, being able to drive all these changes. But I think even outside the agency, the customs agency is going to be very critical, because in many cases, products, whether they're pharmaceutical or vehicles or anything, as I say that on purpose, the first touch point is not the health sector. It's actually the generic country customs agency, right? So there has to be some type of linkage between those. It's something that has been overlooked. In Ethiopia, we've now starting to integrate import information from the customs agency to the Ethiopian Food and Drug Administration and vice versa. So I would definitely say that the customs agency of a country is very much important. And also when it comes to procurement agents, not just a country procurement agent, but even other procurement agents, for example, UNICEF buying a lot of vaccines, or UNICEF doing procurements on family planning. Sorry, UNFPA, apologize. We need to engage them just broader than just saying that we need to comply, because it's going to require a lot of changes in how they conduct procurements. It's going to have impact on costs because we're going to be expecting more than just products, right? We're also expecting a huge amount of data to be processed and sent along the way. And also maybe donors, right? Right behind procurement agents, there are donors too. So this impacts a lot of financing for countries. What has been priced as to what it will cost to buy a particular medicine may not necessarily be the same price, once we put in these conditions in place. So yes, so I would definitely say adding in the country customs agency into play is going to be very critical, as well as the procurement agents and a little bit with the donors as well.
Great. Thanks for that follow-up there. Prof, DG Adeyeye, coming back to you. I said we're going to try to take a bigger picture here, so I'm going to press you just a little bit as a having headed the African medicines regulatory harmonization effort. And we heard that AMA may be involved in harmonization and pushing that agenda, but really talk to us about this successful sort of blend between national ownership, the steps that you can take at a country level and that Nigeria, for instance, has initiated, and some sort of larger Pan-African push, something that's coming down maybe from a political level, ministers of health level, or even heads of state. How do those meet up? And what's the right blend?
Thank you again, Tom. Yeah, that's a very good question and a big one, actually, because as the chair of the steering committee for AMRH for 5 years, we focus a lot on harmonization at the continental level and at the regional level. But unlike what you can easily do with post-marketing, surveillance, doing good distribution practice, or laboratory consortium, forming laboratory consortium, traceability is more involving. It is more involving, and that is part of the reason why I said that NAFDAC has come up with some expectations, minimal expectations, that we will want our fellow NRAs to have or to realize that they need to provide from the beginning. Governance was mentioned. There must be a structure, no matter how simple the structure is in each country. Again, West Africa has 16 member states. All the 15 rather, members say all the 15 cannot be on it at the same time. And that is part of the reason why I really appreciate this Francophone, third Francophone meeting, because West Africa is so complex. We have Portuguese, we have French, we have English. So in terms of making sure that we can read the universal language of science, we have to be creative, which is part of why this meeting is very important. So if you have this baseline assessment rubrics or bullet points, then you share it with, we share it with our fellow NRAs, what they think they don't have. Once they see the rubrics, they may say, oh, we have this, but we need help here. we have that. We need more help there. Very, very important. If we can have 10 very strong traceability platforms, or 10 countries with traceability platforms, I think it is a good way to start towards AMA. It is a good way to start. For example, training. Training is so important. We have trained over 20,000 healthcare workers and the like in Nigeria. We got funding from Global Fund, and it was good that they made us to focus on training, because it's a change of mindset. It's a change of how to do things. You scan in, scan out, look at data, see whether there is infiltration, diversion, or whatever. So the training is very important, and I'll mention that. The communication, of course, is part of the training, and it's also part of data sharing. For example, in terms of even within the country, which again, any country that will be mentored or that is getting there in terms of strengthening their system, their traceability system, must be able to collaborate. We work closely during the pandemic with our immunization agency, the National Primary Health Care. We work with the hospital systems. They are part and parcel of our steering committee. Almost everybody, almost all sectors are part of the steering committee of traceability in Nigeria, and that meeting takes place every other month. The community practitioners, pharmacy practitioners, manufacturers, of course. We have been training our manufacturers for more than 2 years to get them ready. And all these things have to be backed up by a legal framework. We started without regulation. Now we're going to have our regulation, the gazetted one will come out maybe in about a month, because everybody has to see how they fit in and how they can interact with the whole within the ecosystem. So very, very important. Customs was mentioned. Yes, we have gone to introduce and semi-train, some custom officers. It's not going to be one time. But once this is well highlighted, underscored at the national level, and is presented to a sister agency, these are some of the things you should be looking at. What probably took NAFDAC 2 years to realize will take that sister agency a much shorter time. And I believe in small models. You start small and then you start scaling up. That was how we started in NAFDAC with vaccines, COVID-19 vaccines. Then we moved to non-COVID-19 vaccines to capture all of them on our database. And now we are now looking at or working on ATM Global Fund products, antiretroviral, anti-malaria, anti-tuberculosis. So we are monitoring those now. These are all public commodities. We are now going to private commodities, and we are starting with narcotics, because we realize there's a problem with monitoring of narcotics. Even that, it is only for the manufacturers that deal with narcotics. And we are going to start scaling up over years. It's not going to take place in 1 year. We had a 5-year strategy. Our 5-year strategy is ending this year. So we're going to have another 5-year strategy, but with defined goals, defined KPIs. Where do we see ourselves in 5 years, in 3 years, or whatever? So it is extremely important to ensure that others are guided in terms of what they need to consider, so that time is not wasted unnecessarily. Thank you very much.
Good, thank you. So I heard from you that there's some certain baseline expectations, things that a National Medicines Regulatory Agency needs to have in place, and that some of your experience can be shared with others to help them kind of shorten their runway. Now, obviously, that's not NAFDAC's job. It's not your main job, and you may need help to achieve that. So I guess maybe let me turn a question back to Dr. Shabi about AMA and thinking about how assistance can be provided to, let's say, mentor some of these regulatory agencies in less developed countries where maybe they haven't reached that maturity level. Dr. Shabi, could you just speak a little bit about the role that AMA might play in the future, recognizing these are early days, focused on, what do you need? What would AMA need to kind of help countries along as Nigeria has? Would it be technical staff? Would it be budget? What exactly would be required for AMA to play a role of supporting regulatory agencies with their traceability journey?
Merci, Tom, pour cette bonne question. En fait, je vais l'aborder à travers quatre aspects. Parce que quand je prends le cas même de l'AMA aujourd'hui, c'est une institution, c'est vrai, spécialisée de l'Union africaine, mais il n'y a que 26 pays africains qui ont adhéré donc, ou qui ont ratifié ce traité et déposé les instruments. Nous sommes déjà, même au niveau de l'AMA, dans une dynamique de plaidoyer pour que les pays, en fait, adhèrent à ce traité et que nous puissions avoir le grand nombre pour faire une lutte commune ensemble. Et donc, je partirai de là pour dire que nous avons besoin, premièrement, d'une volonté politique. Il faut une volonté politique pour accompagner la vision de la lutte. Je mets l'ensemble traçabilité et tout dans la lutte contre les médicaments de qualité inférieure et falsifiés. Et nous avons besoin que nos États, au plus haut sommet, donc manifestent une volonté politique pour que les mécanismes qui vont nous permettre de radier ou d'endiguer le phénomène de lutte contre la prolifération ou la circulation des médicaments de qualité inférieure et falsifiés devienne une priorité. Et donc, c'est au sein de ces mécanismes que nous allons développer maintenant la traçabilité qui va permettre donc d'atteindre cet objectif. Donc, premièrement, je voudrais noter la volonté politique de nos gouvernants à tous les niveaux. Ensuite, il faudra maintenant faire une coordination et c'est là que l'AMA pourra vraiment intervenir en tant qu'institution continentale, donc intervenir pour faire une forme d'harmonisation, une forme donc de coordination des actions au niveau des États, donner des orientations, et c'est ça d'ailleurs le rôle de l'AMA. L'AMA ne va pas remplacer les États. Ne va pas remplacer les agences nationales de l'économie. Cette agence va intervenir pour harmoniser les pratiques et permettre donc aux pays d'avancer ensemble. Donc, on aura besoin de la coordination, faire une coordination au sein des États à partir donc d'une
Okay, well, we'll hear more from Dr. Shabi. He said there are 4 buckets. He described 2, so I'm waiting for the last the last 2. Okay, he might be back. Dr. Shabi, do you have your other 2 buckets that you were describing? You have governance, and then you talked about coordination, which AMA could help with. What else do you think? Are you back with us, Dr. Shabi? Give me a wave if you're hearing okay.
Yeah.
Okay.
Ça va?
Ça va.
Oui, ça va.
Voilà. Donc, ouais, je parlais vraiment de la formation et je disais que je connais les difficultés que nous avons eues au niveau pays déjà pour identifier ou définir le modèle de traçabilité qu'il faut même adopter. Et donc, au début, on a commencé, on ne savait pas où on allait, qu'est-ce qu'il fallait faire. Nous avons fait appel à GS1, nous avons fait appel à des experts, etc., parce que nous avions besoin d'être orientés, d'être guidés, d'être accompagnés pour justement choisir le modèle qu'il faut, choisir les mécanismes donc, qui sont adaptés à nos réalités et permettre de faire une traçabilité qui est vraiment pertinente. Donc, il faut de la formation. Il faut de la sensibilisation également. Il faut former, il faut informer et permettre donc à tous les acteurs de prendre conscience parce que là, aujourd'hui, ce n'est pas une question des régulateurs tout seuls. Nous devons associer les fabricants, nous devons associer les professionnels de la santé. Bien évidemment, j'ai parlé tout à l'heure des gouvernants. Donc, il faut que tous ceux-là soient sensibilisés et que les acteurs soient formés pour que nous puissions réellement atteindre les résultats qui sont attendus au niveau continental. Et également, je vais parler maintenant de l'appui technique. Donc, cet appui technique, il est un peu inclus déjà dans la formation, mais il y a également l'accompagnement dont les pays ont besoin.
We'll give it just 1 second, and if not, okay, I think we have you back, Dr. Shabi. You were talking technical support. Moving on
Voilà.
to technical.
L'appui technique, donc je disais qu'un appui technique au niveau de l'AMA sera nécessaire. Bien sûr, cet appui technique descendra au niveau des pays. Si les comités techniques de l'AMA, parce que vous savez, dans l'organisation de l'AMA, il y aura des comités scientifiques, il y aura des comités techniques. Si nous arrivons à mettre en place des comités techniques qui sont formés par rapport à la traçabilité, qui ont les notions essentielles, nous pouvons à partir de là donc descendre au niveau pays pour que la dynamique soit répercutée dans les pays et voilà, permettre aux pays d'adopter les modèles qui sont les plus appropriés pour faire la traçabilité dans leur pays. Et bien entendu, l'appui, le dernier, c'est l'appui financier parce que c'est un budget énorme que cela représente. Le Nigeria a fait l'expérience avec les vaccins. Je ne sais pas ce que ça leur a coûté, mais aujourd'hui, nous, au Bénin, ce qu'on est en train de faire, on ne connaît même pas le coût de ce mécanisme de traçabilité. Au début, on nous avait dit 4 milliards de francs CFA, mais on se rend compte que c'est bien au-delà des 4 milliards parce que il faut non seulement mettre la technologie, la solution elle-même, mais ensuite, il faut mettre le matériel qu'il faut, les équipements, et il faut que toutes les structures qui accueillent le médicament soient impliquées dans le système, sinon rien n'est fait en fait. Donc, on ne peut pas tracer une partie dans le pays et laisser l'autre partie. Il faut que tout puisse aller ensemble. Donc, du coup, il y a un budget énorme que les États, à eux seuls, à mon avis, ne pourront pas soutenir, même si quelques-uns ont la force pour y arriver, mais tous les États ne pourront pas financièrement soutenir le processus pour l'implémentation de la traçabilité dans les pays. Et donc, un appui au niveau continental qui descendra au niveau des pays sera vraiment quelque chose de salutaire pour permettre à la dynamique de prendre de façon unique. Donc, voilà les aspects sur lesquels je pense que l'AMA peut être accompagnée, soit par les partenaires techniques que nous avons déjà, qui cherchent sérieusement à nous aider, mais également, il faut la contribution des États parce que c'est le fonctionnement hein, des institutions de l'Union africaine. Les pays doivent participer, il faut une contribution des États, même si les partenaires doivent nous venir en aide pour finaliser ce qui est commencé. Donc voilà, Tom et chers amis, les éléments que je peux partager pour le moment, en attendant que la réflexion soit davantage mûrie hein, au niveau de l'AMA et bien entendu des autres comités techniques qui accompagnent. Merci.
Thank you very much indeed. So just to reiterate, those buckets were the governance, some coordination at the AMA level, also technical support, technical committees. And lastly, Dr. Shabi highlighted budget, need for resource, which we all understand. So I'm going to jump around a little bit and come to you, Al. Not because you're at the Gates Foundation. Well, yes, because you're at the Gates Foundation, but I think you have some experience at the national level of coordinating the different stakeholders that need to be involved. And that includes, of course, government agencies, but it also includes the private sector, which I think have a role to play and should be brought into this question of how do you fund traceability. But in addition, the donor community. So talk to us a little bit, Al, if you would, about your experience in Ethiopia and beyond, recognizing that there needs to be coordination across government agencies, private sector, as well as donor institutions, especially around this issue of funding. Over to you, Al.
Right. Thanks, Tom, for the question. In terms of the government, the one thing that really needs to be recognized is, traceability is as important as it is, and the need obviously increases over time. I was really connected to what Professor Modi said about the narcotics and drugs and so on, where we have a lot of issues around and across countries. So the need is absolutely there. I think one thing that needs to be definitely said, though, is that it will actually add cost to how the supply chain management system works. We can't expect countries to be able to add this level of service and not expect for it to be, to add cost, just, I guess, to repeat myself. So this applies, though. You might do this well on the government side, because government central medical stores can choose on their own to make this adjustment to their costing. But it becomes a little tricky when it comes to the private sector, because now we're asking them to provide us data, but in effect, we're asking them that this might end up adding further cost to them. So there needs to be a great deal of thought, and I think I very much like to say that there needs to be a very honest conversation before these regulations are come in place or enforcement can happen, and having that conversation between the private sector as well as with the government to see how practical it is. Because I think if you move forward without those consultations and understanding what that cost increase will do or have impact to the system, very likely it's not going to be complied, or people will try to get around it, and obviously nobody wants it. My personal opinion when it comes to the role of the donor is to help catalyze, to help fund initial steps, maybe on the governance side, maybe on the communication side. But this definitely needs to be something that the government can pay for itself. I don't think you can build a system such as traceability and expect it to be donor funded on a continuing basis. It simply is not going to work over the long period of time. So I think the donor community has a huge role to play in being able to help countries to jumpstart. But the actual operational cost, in my mind, is very clear. That has to be managed and carried by the government itself. But this very conference itself, I mean, it demonstrates a value of how the donors are playing in bringing in this concept to the countries, and the countries are now picking it up and taking it on their own. Back to you, Tom.
Fabulous. Thanks, Al. I couldn't agree more. Government ownership, national ownership with a little bit of catalytic support at the front end by the donors. That makes perfect sense to me. Now, I want to come back to Trish real quick. The van has been around for, what, 15 years? How are you going to continue to advocate and push for visibility in supply chains, both in West Africa, but certainly beyond, more globally? What's your plan for the van?
So there's something really important that Dr. Chabi said that I would just like to highlight, and that is the connection points down into the country itself of all of the different facility levels. If you really want visibility, that has to be a part of your plan, and it's not easy, as he mentioned. It's not easy to get there all the way. Lots of countries are in different states of it. I think for the van, we don't want to let the perfect be the enemy of the good. Right? We want to have as much visibility as we can possibly get now and to continue to work to add that visibility. And that is part of the coordination that's required within the national level and then at the regional level, such as, for example, with our West Africa strategy. We have some very strong leadership there from the West African Health Organization, from WAHO, to help us bring countries together and really talk about how are we going to expand that visibility and get to some of the issues that Dr. Chabi mentioned and that Al also touched on. I do think also that for us in the van, a real inflection point where traceability and visibility meet is at the door of the central medical store or at customs and import. And that's a really difficult data set to get a hold of and to manage. So I think we're looking into understanding better how we can marry those two pieces of information as we get visibility on shipments coming into a country. And then what happens when they get to customs? Where does that go? And what information might a traceability system need to have from that in order to continue its work, its vital work of ensuring the quality of medicines? Thank you.
Good, thanks, Trish. We have, believe it or not, we've blown through the hour almost, and I still want to open it up to participants to ask any questions. So let me turn to the audience here. If you have a question, raise your hand, and I'll try to call on you. I'm not sure I can guarantee I know who raises their hand first, but let's have some questions from the field. And if there are no questions, that means that our panelists did an extraordinary job. Great. Can I ask if there are any organizers who might have a comment or want to amplify anything that was said by our panelists? I think everybody's been worn out.
Yeah.
Rami, over to you.
Thank you. I just would like to highlight more and understand if there is any experience, like Trish mentioned briefly about the WAHO. So if they can elaborate more, what was the role of WAHO in terms of creating the regional approach for the van, and if there is any lesson learned that can go beyond visibility to traceability, this would be helpful.
Thanks, Rami. So I think really the key role that WAHO played is in developing, I would say, the political will. We've heard several speakers on this panel talk about political will and how important that is. And WAHO really brought that together, as well as highlighted how critical this visibility would be and how much it would help the countries both individually and then collectively together as a region to get additional information that would benefit all of them. I think some of the cutting edge things that WAHO is really talking about now are around better sharing information and planning together in the context of visibility, and that's key. So we hope in the future that we might be able to replicate this approach in other regions in Africa.
Great, thank you, Rich. Anyone else? Any of our GS1 colleagues want to jump in or ask any questions, comments? I know you've had plenty of time, shared screen time over the last 3 days. So I don't want us to tread old ground. Let me just take then this time to thank the panelists for an excellent discussion. I think we did take a little bit of a bigger view of things. We got out of the weeds, so to speak, heard a little bit about what it takes to make a national system grow, and recognizing there are milestones along the way. So thank you, Professor Moji, for sharing Nigeria.
Tom, can you unmute, please?
Yes, thank you. I think they're trying to cut me off. Trish, thanks for all the work that the van does. Thanks for joining the panel. Al, we look forward to the Gates Foundation continuing to support this work and drawing on your excellent national level experience from Ethiopia. Thank you for joining the panel. And to my friend, Dr. Shabi, good to see you again. We wish you all the luck at AMA. Let us know how we can help. And we look forward to support from that Pan-African level to meet up with the national level commitments to greater visibility in supply chain, ultimately leading toward full traceability. So congratulations to everybody on this conference, and we look forward to seeing you again very soon. Thank you from the Global Steering Committee. Thank you from me, Tom Woods, and everybody have a great day.
Thank you. Thank you so much, Tom. Thank you, GS1 and the co-panelists. Thank you.
Thank you. It's been a pleasure.
Thank you.
Donc, merci à tous pour ce dernier panel du 3e jour du sommet. Et donc là, on va passer au mot de conclusion, closing remarks. Et donc, je vais passer la parole en premier à Josh et ensuite à Simplice et ensuite à Géraldine.
Merci. Merci, Angela. Vous m'entendez bien? Oui, je vais commencer à clôturer par des remerciements. Je ne vais pas citer le nom des gens parce que vraiment, il y avait beaucoup de personnes qui ont beaucoup contribué à l'organisation programmatique et technique et logistique de ces sommets. Mais je tiens à remercier l'OMS, le bureau de GS1 et le USAID pour leur contribution à l'organisation de ces sommets. C'était un travail assez long depuis des mois et je crois que grâce à ces efforts, c'était un succès. Je vais remercier aussi mes collègues des projets FTO ici à Bénin, mais aussi dans notre siège à Washington. Il y a beaucoup de gens qui ont contribué énormément et logistiquement à ces sommets. Je voudrais aussi remercier tous les participants, tous les présentateurs qui ont sacrifié de leur temps pour passer ces derniers 3 jours avec nous. Avant-hier, le premier jour de ces sommets, un de nos collègues a présenté une carte du monde avec tous les pays et leur niveau d'adoption des standards GS1. Et c'était évident que pour le moment, l'Afrique et surtout l'Afrique francophone est derrière le reste du monde en termes d'adoption des standards et traçabilité pharmaceutique. Mais je dis pour le moment parce que je crois que ces sommets a été une grande étape vers la traçabilité pharmaceutique et vers l'adoption des standards GS1 pour tous les pays qui ont participé à ces sommets. Je crois aussi que ces derniers 3 jours, nous avons retenu que le pays de l'Afrique francophone, surtout, ne commence pas à zéro. C'est évident que, premièrement, il y a une volonté politique qui est primordiale à travers ces pays. Mais aussi, c'est évident que chaque pays a sa propre écosystème, y compris des avancements sur la numérisation des systèmes de santé, sur la numérisation des systèmes sur les chaînes d'approvisionnement. Et je crois que chaque pays a son propre chemin à faire vers la traçabilité pharmaceutique, mais avec ce que nous avons partagé ces 3 derniers jours, nous avons vraiment une meilleure compréhension de la complexité de ces voyages, mais aussi qu'il y a vraiment beaucoup de ressources, beaucoup des outils, beaucoup des experts qui sont disponibles pour tout le pays pour commencer ou pour continuer le chemin vers la traçabilité pharmaceutique. So, encore une fois, je vous remercie et on va se rejoindre, je crois, l'année prochaine pour le 4e sommet GS1 pour l'Afrique francophone.
Dear colleagues and distinguished participants, good afternoon or good morning, depending on where you are streaming from. As we wrap up the 3rd Francophone Africa GS1 Healthcare Summit on the theme Digital Health Supply Chain, where does traceability fit in? It is my distinguished honor to thank all of the stakeholders who contributed to this successful event. Special thanks go to the 100+ participants who were connected throughout the sessions from the various parts of the world over the past 3 days. I would like to commend the joint partnership that led to investment in time and resources to put this high quality summit. The presentations were able to bring together, close the gaps in terms of knowledge on the traceability and visibility. I want to mention colleagues from GS1, the WHO, UNICEF, the Global Fund, Chemonix, and all our distinguished panelists, speakers, and presenters. Here are a few takeaways that I noted from the engagement on the important topic of supply chain digitalization from our 3 days of engagement. Number one, the emphasis on the need to consider traceability within the larger digital system, ecosystem. Countries are encouraged to focus on building a strong foundation for system interoperability based on global standards as GS1. The upcoming WHO guidelines will help countries to plan holistically for digital supply chain transformation, including traceability. And lastly, digital transformation of the health supply chain, it's a marathon, not a sprint, and it does require holistic planning. I look forward to hearing from you all on the implementation of some of the innovating ideas from this summit. We are grateful for the government of Benin for accepting to host the in-person part of this summit in Cotonou. Finally, I would like to thank the logistic team, the event organizers, and the planning committee from Global Health Supply Chain, Francophone Task Force, GS1, WHO, and USAID. Thank you very much.
Merci à tous. Donc, je pense que maintenant, je suis la dernière. Et l'avantage quand on est la dernière, c'est que je n'ai pas besoin de refaire tous les remerciements, mais quand même, je vais prendre le temps de remercier tous ceux qui ont contribué à l'organisation de ce sommet, USAID en particulier, Angela et Nouran et tous ceux qui se sont réunis toutes les semaines pour préparer cet événement. Merci à tous ceux qui ont pris la parole et tous ceux qui ont partagé leur expertise et à tous ceux qui ont posé des questions ainsi qu'aux traducteurs. Et merci bien sûr aux honorables représentants du Bénin pour avoir accueilli en personne les participants pour cet événement. Donc, lorsque nous avons commencé ce projet, on en est déjà au 3e sommet sur les soins de santé pour l'Afrique francophone. Nous pensions juste partager des connaissances sur la mise en œuvre d'un système de traçabilité, sur l'importance pour chaque pays de diriger cette initiative de manière cohérente et harmonisée afin de protéger les patients face aux risques posés par les médicaments contrefaits. Et puis, en fait, on s'est rendu compte au fil des sommets que toute l'énergie et tout l'intérêt qui ont suivi nous conduit aujourd'hui à mettre en œuvre quelque chose qui nous permet non seulement d'explorer les progrès et les développements qui sont faits dans plusieurs pays d'Afrique, mais aussi d'élargir les discussions, et c'est ce qu'on a fait avec le sommet cette fois-ci, pour mieux comprendre l'entièreté de l'écosystème de la digitalisation de la chaîne d'approvisionnement des médicaments en Afrique. Et donc vraiment, si j'essaie de résumer ces 3 jours, je pense que l'importance de la collaboration, encore une fois et toujours, entre les pays, avec les organisations de soutien au développement et avec GS1 a été confirmée, et le succès de cette approche a aussi été confirmé. Donc, il n'y a plus de langue, il n'y a plus de frontières quand il s'agit de protéger les patients. Vraiment, nous devons continuer à tous travailler ensemble. Il y a tout un aspect aussi lié à la persévérance. Donc, Supplice vient de mentionner l'idée d'un marathon. Effectivement, il faut définir un objectif commun et il faut avancer pas à pas pour pouvoir tenir la distance et vraiment construire tout ça sur des fondations qui sont solides, qui s'inscrivent dans un cadre réglementaire qui est harmonisé et qui repose bien sûr et toujours sur la détermination des autorités d'un pays. Sinon, rien ne fonctionnera. Donc, cela prend du temps. Ce n'est pas toujours facile, mais nous savons que ça fonctionne parce qu'on l'a vu encore cette semaine et on continuera à le voir. Les pays avancent, les pays progressent et ces pays-là, comme l'a dit professeur Mouchi, sont aussi là pour partager leurs bonnes pratiques, pour partager les leçons qu'ils ont apprises au fur et à mesure qu'ils progressaient sur ce marathon. Et enfin, avec cette 3e édition, nous avons vraiment voulu souligner le fait que la traçabilité est un des éléments qui permet de soutenir cet effort de digitalisation de la chaîne d'approvisionnement de la santé. Et cette digitalisation, aujourd'hui, elle est essentielle. Elle commence avec n'importe quel système de gestion des données qui vous permet de donner de la visibilité à votre chaîne d'approvisionnement. On l'a vu avec notamment les guidelines de WHO qui commencent avec des systèmes de gestion de stock, d'enregistrement des produits, des systèmes logistiques. Donc, n'importe quel système qui vous permet de savoir où est un produit et où est-ce qu'il va aller et où est-ce qu'il a été. L'important, c'est de construire un système qui est intégré, qui s'appuie sur le système de standard GS1 pour que ce soit interopérable et sur tous les outils qui sont existants dans un pays pour pouvoir vraiment commencer. Et donc, vous avez aussi entendu les organisations telles que UNICEF ou USAID qui ont présenté Trust et TIOP, il faut que je m'adapte pour la prononciation, qui ont ces outils-là et qui restent bien sûr disponibles pour vous aider, le Global Fund également. Donc, si je dois résumer, ça sera continuer à travailler ensemble, continuer à avancer. C'est un marathon, mais on y arrive à chaque fois. Chacun à son rythme et surtout, bâtissez des fondations en intégrant les systèmes de manière interopérable et sur la base des systèmes GS1. Et tout ça pour la sécurité des patients. C'est vraiment ça qui doit nous forcer tous les matins à nous lever et à rester motivés tout au long de ce marathon. Voilà pour mes mots de clôture. Et en attendant d'avoir le plaisir de vous retrouver l'année prochaine, comme l'a déjà anticipé Josh, je vous invite tous à continuer à échanger. Donc, on va avoir différents workshops organisés par les organisations partenaires dans les différents pays, mais on va aussi avoir une conférence GS1 comme tous les ans, sauf que cette fois-ci, elle sera en ligne. C'est pas plus mal, comme ça, personne n'a besoin de voyager et tout le monde peut se connecter d'où qu'il soit pour participer à cet événement. Vous voyez ici sur l'écran le détail et l'invitation formelle. N'hésitez pas à vous connecter. Et pour partager un secret, mais vous le verrez aussi bientôt, en 2025, nous nous retrouverons en personne. Donc, ne soyez pas déçus sur le fait que ce soit une conférence en ligne. En 2025, nous serons en personne et ce sera le 20e anniversaire du GS1 pour la santé. Voilà, sur ces mots et sur cette invitation, je vous souhaite à tous une bonne fin de semaine, un bon voyage pour ceux qui ont voyagé. Prenez soin de vous et à très bientôt.